हाँ जी हाँ।
आज 9 बजे की भी नहीं किसी के लिए?
हाँ जी?
9 बजे की?
नहीं आज नहीं, आराम से पड़ा। पीपीटीज में है ना, पीपीटीज वाला फोल्डर है ना, पीपीटीज आज क्या है टॉपिक?
ये है बायोटेररिज्म।
ये वाला दो है, बायोटेर वाला खोल के देखो,
ये 24 में
ये वाला खोल के ये
मुझे वही था कि मैं बात कर लूँ उससे कि अगर नहीं कुछ सुनाई दे रहा फ़ोन कर देना ताकि मैं आगे ना बोलूँ।
ये 81 वाले मौका कैसे जो बता रहा हूँ,
मेरे तो ये तीसरी क्लास है, पहली क्लास में तो वो सेटिंग ही नहीं हुई।
वो तो पहले ही जो एक्टिविटी मेरे को याद है।
हाँ, फिर दूसरी दफ़ा पूरा लेक्चर
सीधा था और आपका था।
हाँ, फिर सेकेंड टाइम पूरा लेक्चर
तो वो तो आपका वहाँ करा दिए थे ना दोनों के।
हाँ, वहाँ फिर दूसरा लेक्चर भी वैसे ही
वो
करना
में
पड़ा। यहाँ पूरा लेक्चर ले लिया, फिर सीआर का फ़ोन आया 9 बजे कि कुछ सुनाई नहीं दिया इनिशियल 5 मिनट के बाद। तो मुझे वही हो रहा है, फिर वही कुछ होना है।
नहीं ऐसे नहीं होगा, वो देखना लॉगिन कर दिया या नहीं मैंने, ऐसे तो चल जाएगा। लॉगिन किया नहीं।
हाँ, किसी कोई नहीं
फोन कर देता हूँ
किसको करेगा?
सीआर
को मैं भी कर रही हूँ, पीयूष ना।
हाँ जी हाँ जी,
वो तो कोई फ़ोन ही नहीं कर रहा, उठा ही नहीं रहा।
वो सब सो रहे होते हैं ना ये। कोई नहीं, वो जैसे भी इसको छोड़ूंगा वो कर लेते हैं, लॉगिन कर लेंगे।
प्रोवाइडर उनको वहाँ जा रहा है।
कोई नहीं, आप स्टार्ट कर लीजिए, वो लॉगिन करना स्टार्ट कर देते हैं जैसे।
हाँ, मैं वो तो करती हूँ, तो ये क्रॉस करना है बस, सब ये ना बोलेंगे।
हाँ बस ये ठीक है, तो मैसेज स्कूल देख के वो कर लेंगे, वो सबका मैसेज वो कर लेंगे।
आप ज़रा बता देना मुझे अगर नहीं कुछ वहाँ पहुँच रहा है इनको तो
नहीं, मेरे को फ़ोन आ जाता है, मेरे को बता देते हैं कि हमें साउंड नहीं आ रहा है।
लास्ट टाइम तो हुआ ही नहीं, लास्ट टाइम तो कुछ भी नहीं, पूरी क्लास ख़त्म हो गई और फिर सेट फैसिलिटी मुझे लगा शुरू से हमें वही करनी चाहिए।
ये इनको रखना ही वहीं था मैडम, ये जो बनाया है ना ये कन्वर्जेंस ब्लॉक में, वहीं पे रखना चाहिए था इनको ये, क्योंकि वहाँ सारे
हाँ लोग है ना जो
टेक्निकल वाले लोग हैं वो
टेक्निकल वो तो कर।
हाँ जी हाँ जी स्टार्ट।
Good morning everybody. Today's lecture is on bioterrorism. Now this is a topic which is of great contemporary value now. We ourselves are going through a pandemic of COVID which we do not know whether it was a biological attack or elsewise. Now what is bioterrorism? It is a form of terrorism. Terrorism is defined as the unlawful use of force or violence against persons or property to intimidate or coerce a government or civilian population in the furtherance of political or social objectives. Now today we have reached a moment in time when the entire history of humanity is in danger of being wiped by the misuse of mere microorganisms. So as the word you understand, bioterrorism, made up of two words, terrorism caused by means of using microorganisms, biological warfare. Now, according to NATO, potential biological warfare list has been identified, including 31 infectious organisms. Basically, all biological agents, microorganisms, cannot be used for biological warfare. There are characteristics which enable an organism to be a potential candidate for usage as a biological weapon. So NATO has basically classified around 31 organisms which could be used as biological agents. Now, the Russian panel of bioweapons experts reviewed that out of those 31, 11 were likely to be used. Now, the top 4 agents which can be used for biological warfare include number 1, smallpox, number 2, plague, number 3, anthrax, and number 4, botulism, Clostridium botulinum. Now, lower on the list are other organisms causing conditions of tularemia, glandus, typhus, Q fever, venezuelan, equine encephalitis, Marburg, and influenza viruses. So of the list of 31 potential biological agents, the top 4 are smallpox, plague, anthrax, and botulinum, Clostridium botulinum. Now, as this is a list of these agents to repeat, now this is smallpox, the first one. The infective dose is given, the incubation periods, the diagnostic samples we will be needing to confirm that the biological attack has been due to that agent, and the diagnostic assays. Now, these are organisms which you must have read during the course of your microbiology lectures. So this is just a brief review of all, and the samples, depending upon the site, mainly like if it's the aerosol route, involving the respiratory system, you'll have samples like pharyngeal swabs, scab materials, anthrax blood, and you can see that they require biosafety levels 2 or 3 for processing of the samples. And diagnostic techniques include right from if it is cultivable and culture, then the rapid techniques like serological assays like ELISA, then yes, the PCR, viruses need to be isolated, and other immunofluorescent assays. So depending upon them, you can see this whole list of probable agents of biological warfare. And you can see like botulinum, the infective dose is so small. It's one of the most potent exotoxin produced. 0.001 milligram per kg body weight is all that you require. Now that the list goes on with brucellosis, Q fever, tularemia, yes, even staph, which is not a very potential agent. Now, what are the characteristics? If you think from a terrorist point of view, what would you like in your biological agent to be so that it could cause mass destruction of life? One is it must have a wide range of affects the entire systems of the body. It should be easily obtainable from nature. It should be easily made by relatively unsophisticated methods. That is why biological agents, these agents of biological warfare, are also known as a poor man's atom bomb, because the cost to make them is meager. You need simple methods and easily available agents which can be used. It should be invisible to the senses. You should not be able to see it, you should not be able to smell it. So one would not even come to know when the attack has already occurred. By the time one, we realize that the attack has occurred, by that time mostly nothing can be done after that. The effects may be delayed, and it should produce mass casualties. Now, if you think of bioterrorism, is it something new? Is it a new concept? We started teaching bioterrorism just a few years ago. Before that, it was not in your course curriculum. But if you read history, you'll see bioterrorism has a very, very long history. Basically, a man's mind can be used as a devil too. Now, bioweapons have a long history. Recent use includes, they have been used in World War I, they've been used in World War II, in World War I. Scandinavian countries used it on the Russian Imperial Army. In World War II also, we saw the Britishers trying to use biological weapons on the Germans. So we have recent uses. In the 14th century, the Tatars reportedly catapulted bodies of plague victims into the city of Kaffa, that is victims of plague, so that to spread the infection further. During the French and American Indian Wars and American colonial days, it is said that the Britishers deliberately gave Indians blankets contaminated with smallpox. So US, Canada, Great Britain, Japan, USSR all experimented with anthrax during World War II. And in 1991, if you remember, the war between the US and Iraq threatened the use of bioweapons against US troops in the Persian Gulf War. In fact, that was at the time when these US soldiers were vaccinated for anthrax because of the possible threat of usage of anthrax as a biological warfare agent. Recent years, in 1986, biological weapons have also been used by religious organizations. The Bhagwan cult poisoned an Oregon salad bar with salmonella because some district elections had to be taken place. They didn't want people to vote, so you have salad bars which were contaminated with salmonella, making 715 people sick and less people coming for casting their votes. And in 1995, the Japanese cult released the nerve gas sarin in a Tokyo subway. So to imply that biological warfare is an age-old concept used right from the 14th century onwards, from wherever we have records of history, till date where it is still being used. Now coming to the agents, as I said, the top 4 agents, first is smallpox. Now smallpox is caused, it's a viral infection caused by the variola virus, and present initially, our age group, we were vaccinated for smallpox, but now it has been eradicated. Now, most deaths of any infectious disease, it had caused 500 million deaths in the 20th century, 2 million deaths in 1967. So it was caused a lot, but finally it got eradicated because we have the availability of a vaccine. Now, why was smallpox? Why do we consider it a likely agent? Because it can be produced in large quantities. It is stable for storage and transportation. So anything which is easily available, doesn't cost much, we can stock it, store it without much problems, is a good biological agent, and it produces stable aerosols. You know that inhalation is a very good mode for transmission of infection if you want huge casualties to be involved. It has very high mortality, it is highly infection, and there is person-to-person spread. Now, most of the world, your age group, has little or no immunity at all, because the last case was detected in 1977 in Somalia, and smallpox, the world was declared smallpox free. Smallpox was eradicated in 1980, so no further vaccinations are taking place in the population. So hence now most, except maybe our older generation, which may be having little immunity still left, but the rest do not have any immunity, and this is a highly infectious agent which can be spread by the aerosol route, and since we have no immunity to it, there will be mass casualties. Now there are WHO has sanctioned 2 repositories for where the smallpox virus still is there in stocks, that is at CDC Atlanta and in Russia, but we do not know what are the extent of clandestine, the organism being stored. Now the vaccine stock is also very, very limited now since it has been eradicated. You have the Bioterrorism vaccine. So and In addition to, so that means if we have a biological attack, number one, we have very limited vaccine available. And the possibility is there because in the world, even though we think it's only CDC and a place in Russia which has the WHO sanctioned repositories, there are many countries which do have clandestine stocks of this pathogen. And to add to it, there is a theoretic potential of genetically modified pox virus with enhanced virulence. In that case, the vaccine may not be totally effective, the vaccine which is there, because of the genetic manipulation which can now be done with all organisms. How do we deliver the mechanisms? One mainly is by aerosol. It is the easiest to disperse, and obviously by aerosolization, the highest number of people will be exposed. It is the most contagious route of infection and most likely to be used in a bioterrorist attack, because it's the easiest way where massive number of people can be infected at the same time. You can have also transmission by fomites, which is theoretically possible, but it is not a very efficient method. So the most efficient method for transmission of most of any disease, if you think of it, is the aerosol route. Now all ages and genders will be affected by it. Transmission is person to person. It is highly infectious, less than 10 virions, sufficient to cause infection, and an aerosol exposure less than 15 minutes is sufficient. The mortality is extremely high. In the unvaccinated population, it will exceed 30%. As for most infections, infants and the elderly will be at greatest risk. It will be higher in immunocompromised, may be dependent. We will have to admit patients into ICU facilities, and it will also be dependent on the virus strain, because the existing vaccine strain may not be effective if they have genetically manipulated the strain. So this makes smallpox an ideal biological agent because it is easy to procure, very stable, can be spread by the aerosol route. There will be mass mortality because the population is not immune to it, and we have very little stock of vaccines, and that also we do not know whether they will be effective on account if the strain is the same or has it been genetically manipulated. Now coming to anthrax, this is again a very likely agent of biological warfare, which was also used as an agent after the 9/11 attack in 2001, if you remember. We read about it, that immediately after a week or two after the attack, in the US Postal Service, they received around 2 envelopes of this envelopes contaminated with bacillus, intentionally contaminated with Bacillus anthrax spores. Around 22 people were affected, which also included the Postal Service people, and we had a few deaths. There were cutaneous cases, inhalational cases. So it has been used in the year 2001 post the 9/11 attack. Now anthrax is, gram-positive spore-forming bacillus. Now it is of the gram-positive spore-forming bacilli, you have the environmental contaminants like Bacillus cereus, which is also a cause of food poisoning. Now this is very pathogenic. Bacillus anthracis, gram-positive, aerobe, facultative, anaerobe, capsulated. Now the root is, since it is sporulating, and spores can survive in adverse environmental conditions, it is present in the soil, can last there for years, and the route of transmission is either inhalation of these spores or cutaneous spores getting contaminated in your skin if there are any cuts, bruises, cutaneous, and by ingestion. So you have inhalational anthrax, which has the highest mortality rate. You have cutaneous anthrax, which is the most common but not that high mortality associated with it. And we have the ingestional or the gastrointestinal anthrax, which is also relatively high mortality. And in recent years, anthrax has also been caused, as they say, by injections used generally by drug users. There was an outbreak in UK due to the heroin usage by the IV route. Now coming to the symptoms, patients will have itching lesions, fever, fatigue, depending upon what site. For example, in inhalational anthrax, has a sudden acute onset, high-grade fever. The patient will complain of chest pain and then respiratory distress, resulting in respiratory failure, a hemodynamic collapse. Patient will go into shock and finally respiratory and cardiac arrest. The incubation period can vary from 1 to 7 days. Can go on to 2 months. Now mortality, as I said, is maximum in inhalational anthrax, 80 to 90%. In cutaneous is around 5 to 20%. Now I'll just tell you a little more in details about anthrax. Now this is, as I said, a gram-positive spore-forming bacillus which is spore-forming. It is found widely in soils. Now this is a zoonotic infection. It infects mainly the hoofed animals, the herbivores. They get infected either while they are grazing, which could be either due to ingestion or through inhalation of these spores. And once they enter a favorable environment inside the body of the host, whether it is an animal or human, these spores germinate. Now anthrax, the disease it produces, that is anthrax, is a toxin-mediated infection. The organism, it produces the anthrax toxin, which is made up of 3 components: the lethal factor, the edema factor, and the protective antigen. Now of these, they cannot alone, the 2 virulence factors, well, I would say, is first the capsule followed by the anthrax toxin. Now the capsule of anthrax is made up of poly-D-glutamate. Now this is the only capsule, if you remember, most capsules which you've read, streptococcus capsules, the other organisms, they are made up of polysaccharides. But Bacillus anthracis capsule is an exception, which is made of protein, that is poly-D-glutamate. Now like any capsule, the non-capsulated strains are not virulent, and this capsule is plasmid mediated by transduction. The organism acquires it, and once the capsule, as in all organisms, the capsule basically protects the organism from phagocytosis, the first limb of innate immunity, and it prevents it also from damage by the complement. And then once inside this there is no, it helps in the toxin is it helps in intracellular survival. Now the capsule, you have a staining method which is quite confirmatory that this is Bacillus anthracis, which is known as the Mech-Ferenc reaction. That is, when you culture this organism in the colonies which you see on the media, that are called medusa head colonies, and capsule, when you stain it with polychrome methylene blue, the organism will stain. You'll see bacilli which are blue in color, but the capsule will be purplish pink. So this is very specific for Bacillus anthracis. Bacillus cereus and all will not produce it because of the chemical structure of the capsule made up of poly-D-glutamate. Now we can culture this organism. The media we use, it has to be a selective media. We add polymyxine to prevent growth of gram-negative bacilli. We have lysozyme, we have EDTA, helium acetate, and on that you have the medusa head colonies. Now, as I said, this infection is zoonotic in nature. So you get infection, man gets infected by contact with animal and animal products. So it could be either direct contact with the animal or products like the hides, the fur, the hair, the carcasses and all. So the people who are more susceptible to this infection, who are at high risk, would be those handling animals and animal products. People like the veterinarians, the abattoir workers working in slaughterhouses. This was also known as the wool sorters disease, also known as the hide porters disease. People handling the hides, wool sorters, those who were sorting out wool in factories and all, animals which were infected with anthrax, these people could get anthrax infection. So once the organism, if in the cutaneous route, you get the spores contaminating wounds or some skin lesion on and there you have the formation of a little pustule. There will be an edematous first form of pustule. After that, this gets converted into a necrotic ulcer with the formation of a black eschar. Hence, this is known as, this cutaneous lesion is known as a malignant pustule. Now, as such, normally after treatment it is not very fatal, but if the infection goes uncontrolled, it can result in septicemia, and once the organism starts producing its toxin, it can cause mortality. The other is the inhalational route. Now in the inhalational route, when you inhale the spores, they enter into the lungs. They cause mediastinal hemorrhagic mediastinitis, following which they then enter the alveoli, the macrophages. Then from the lymphatics they go into the bloodstream, and there the organism starts producing its toxin. And similarly, you have the ingestional. If you eat contaminated, uncooked raw meat, and the infection can result in severe abdominal pain and cramps and diarrhea, maybe blood also present in it. So this is the intestinal or the ingestional type of anthrax. Now what is the pathogenesis? Once these spores, as I said, the pathogenesis is the two virulence factors. First I talked to you about the capsule, which like all other capsules prevents opsonophagocytosis. The other is this toxin. The toxin, it has three parts, that is the lethal factor, edema factor and protective antigen. Now the factor one is the edema factor. Alone these cannot cause any damage. It's only when they bind with the protective antigen that do they become active. Now protective antigen, why is it called protective? Because it was shown that this causes production of antibodies in guinea pigs. So it was called protective antigen. Now the edema factor, which is factor 1, when it binds with the protective antigen, it forms the edema toxin, which causes the edematous features which happen in the body. Same way, when protective antigen binds with the lethal factor, it forms the lethal toxin. So individually they are not active, only when they bind with the protective antigen do they get activated. So if you think of it, it's typically the toxin, it's an AB type of toxin, which where B is the binding component. Here the B binding component is analogous, it would be the protective antigen, to which the lethal factor, that is the active components, the lethal factor or the edema factor bind, they become activated and cause damage to the host cell. So you can see the edema and the lethal nature, that is at once the organism starts, you have increased vascular permeability occurring, you have the hemodynamic collapse and patient having multi-organ failure, cardiac respiratory arrest and death. And it's a fatal condition. And once the treatment, as we said, one is yes, the antibiotics, but as you know, for all toxin mediated conditions, once the toxin is released, morbidity, chances of survival is very poor unless antitoxin is given. The antibiotics which are given mainly are the penicillin group, then you can give Cipro, the quinolones and doxycycline. Supportive therapy, vaccination, chemoprophylaxis. Now what about the vaccination? We do have the Stern's vaccine which is available for animals, and if you think of animal anthrax, it is confined to continents like Asia, Africa, parts of Central America, South America, but mostly in the Western world the animals are well vaccinated and protected, so you don't have much of anthrax in the animals. But in case of humans, what are the vaccines available here? Well, we have the vaccine is only given to a selected population. The problem with the vaccine is we have to give at least 5 doses. For the first dose, at 2 weeks apart, first, second, third. Some recommend in another 2 to 3 doses at up to 6 months, 12 months, 18 months. So it's a prolonged course. So if a patient is infected, you give vaccine, it's not going to protect much because it takes time for the antibodies and all to develop. And booster doses have to be given again. And the vaccine which is used is basically the culture filtrate, the protective antigen of a vaccine of the bacterial strain which is non-capsulated, non-virulent. So this is a vaccine and it is given to select population, mainly people who are at high risk of developing anthrax. Like I said, the veterinarians, the abattoir workers, the people handling animal products like their hides, their skins, their hair and all. And yes, during wartime, even the US and all soldiers were vaccinated when they were doing the war with Iran and the Persian, when there was a threat of biological warfare. So that was the time when the American troops were vaccinated for anthrax. But here now recently, obviously because this is going to take time for the immunity to develop, you have a passive vaccine also available in which they're using subunits like of the protective antigen, which is supposed it's the human adenovirus, which contains the beta chain of the protective antigen, so antibodies will develop faster. Now the other agent is the plague, Yersinia pestis, which can also be used as an agent of biological warfare. It is a gram-negative non-motile bacteria. Again, the route would be mainly by inhalation, the pneumonic plague. Symptoms would be cough with bloody sputum, fever, chills, shortness of breath. Treatment, we know plague is streptomycin, chlorodoxy, and yes, formalin killed vaccine to the contacts. So if you see most of these organisms, whether bacteria, viruses, which are being used by biological warfare. As you can see, in general, the route of transmission for all is the aerosol route, and it's affecting the lungs, and then the whole body system is being affected. And we don't have, as you can see, no proper vaccines, no immune system as a prophylaxis available. The other is botulism, that is caused by the anaerobe Clostridium botulinum, and it's one of the most potent toxins produced. Now the source would be, again, it's a sporally organism which produces a gram-positive spore-bearing organism. It would be an aerosol attack, spores, inhalation, and then further the spores being changing into the vegetative forms and releasing the botulinum toxin. Now death, like similarly to Clostridium tetani, here also there is paralysis, there is an inhibition of the release of the neurotransmitters. So death is caused by respiratory failure. Diagnosis is by detection of botulinum toxin by ELISA. Treatment is, yes, antitoxin, but in the case of a biological warfare, you can imagine where are we going to get such large amounts of antitoxin. So just like in anthrax also, whichever conditions, diseases are toxin mediated, immediately if you want to protect a patient, it has to be the antitoxin, because once the organism starts releasing the toxin, that has to be neutralized. Antibiotics will not help. Now this was just to repeat, Clostridium botulinum, which is a gram-positive spore-forming bacillus producing the botulinum toxin. Heat-sensitive, prefers low acidic environment. It's a gram-positive obligate anaerobe. Now the botulinum toxin also, it has the light and heavy chains. The light chain is a zinc endopeptidase, the bioactive component. It is colorless, odorless, environmental survival, so all the features for an ideal biological warfare agent. Now this is just the pathogenesis, just a recap that it prevents, this is the neuromuscular junction, as you can see, and it prevents the release of acetylcholine, as a result of which there is respiratory paralysis. Now normally the neurotransmitters present in these synaptic vesicles, the synaptic vesicles need to fuse with the the muscle fiber, and for this fusion to take place, only then is the neurotransmitter released at the neuromuscular junction. But for the neurotransmitter to be released, and you have these proteins known as the snare proteins, they first have to form a complex with the vesicle. So you have to have the formation of a synaptic fusion complex, and only then does the synaptic vesicle fuse with the neuromuscular junction, and release occurs. So in the present, when botulinum toxin is there, it prevents the synaptic fusion complex formation, as a result of which the neurotransmitter cannot be released at the neuromuscular junction. The vesicle cannot fuse with the membrane, the terminal membrane they do not fuse, as a result of which the synaptic vesicle fusion does not take place with the membrane, and hence the synaptic vesicle does not release the neurotransmitter. Hence this is the way pathogenesis of the botulinum toxin causing the paralysis. The diagnosis, it's a clinical as most of these conditions, like even Clostridium botulinum, botulism, is a clinical diagnosis. You can't wait till the microbiological diagnosis comes, because the earlier you start treatment, the better the prognosis. As such, the mortality is very, very high, and we cannot delay it. So the moment you see a case with features of paralysis suggestive of this, you must immediately start treatment. Now the diagnostic test, this lecture has already been taken, so just to brief, toxin neutralization mouse assay, where we take a pair of mice and we give antitoxin in one and then inject, so the one which is protected, it will not succumb. You have the samples like serum, stool, if it's food poisoning, suspected foods are injected. Then you have a condition known as infant botulism, Clostridium botulinum organism or toxin in the feces, mouse bioassay, and we have culture methods also. Now in the event of a biological weapon accident, what has to be done? Who are the first responders? They are the physicians, the infectious disease experts, specialists, the epidemiologists will be involved, and yes, the hospital and public health administrators. Now first of all, you detect. How do you detect that an attack has occurred? Here, humans will be basically the detector of a biological attack. Then a case definition will have to be made. Notification will have to be done and epidemiological investigation to identify first what was the pathogen which caused it, for which we will need rapid diagnostic tests, and importantly we have to differentiate whether this is an epidemic or a biological attack has occurred. Then medical intervention, where there will be isolation, you have to have usage of antibiotics, antimicrobial agents, anti-sera, vaccines, and you need them in big amounts and sulfurous amounts because there's going to be mass casualties. The prophylaxis, contact healthcare workers and disease control teams will come into play. You have to have both active and passive prophylaxis. Here, passive also has a very important component. Then yes, we are now well aware, we are already going through a pandemic, that is the personal protective equipment which will be needed. Public awareness is the most effective measure, training programs, and to avoid public hysteria. This finishes about biological warfare. We are already going through a pandemic, so these terms would not be new to you, and all that you are seeing, this would be a situation similar to that of a biological attack, which we feel is what we are also undergoing these days. Thank you.